Okay, good afternoon, everybody. Thank you for being here. My name is Victor Balta. I'm the Senior Director for Media Relations and Spokesperson at the University of Washington. My name is spelled, in case you need it, V-I-C-T-O-R. Last name Balta, B as in boy, A-L-T-A. We're here today to answer your questions related to two separate developments at the University of Washington. In the interest of access and transparency, we've made this news conference accessible by phone. We ask that phone participants please mute your phones until the point at which you'd like to ask a question. And again, we'll be trying to make this work as best and seamlessly as possible, so please be patient and work with us as we try to incorporate questions by phone. First, the decision was made to move away from in-person classroom instruction and exams through the end of the spring quarter. I want to be clear, our campus is not closed, and this applies, by the way, to all three campuses, including UW-Bothell and UW-Tacoma. Our campus is not closed as there are vital services upon which many students, faculty, and staff in our community rely. Second, a UW staff member who works in the Roosevelt Commons East building, about 4 blocks off campus, has received a presumptive positive test for COVID-19. This test needs to be confirmed by Public Health Seattle and King County, and we are working with them to do that. With us today in the middle is UW President Anamari Kause. Name is A-N-A space M-A-R-I space C-A-U-C-E. On the far end there is Denzel Sweet, our Vice President for Student Life. His name is spelled D-E-N-Z-I-L, last name Sweet, S-U-I-T-E. And right here is Dr. Jeff Gottlieb, interim chair of the UW's Advisory Committee on Communicable Diseases. Dr. Gottlieb is also a professor of medicine specializing in infectious diseases and a member of the Center for Emerging and Re-emerging Infectious Diseases. So quite the expertise that we have here at the University of Washington. With that, I'm going to hand it over to President Kause to begin, and then we'll open it up for questions.
Well, we often say that what happens here has an impact across the region and the state, and all your presence here on short notice certainly shows that. Moments like this are leadership moments across our university. Sometimes there is leadership that we aspire to. Through our initiative on population health, we have aspired to and have been working to have leadership in areas such as infectious disease and communicable diseases. And we are incredibly lucky to have some of the best expertise in the country here. Other times, leadership is thrust upon you, and I would not have wanted to be in a situation where we have to be making the difficult decisions that we have made in the last few days. But I want everyone to know that, first of all, in making those decisions, we have sought out and used as guidance the very best expertise that we have right here, and expertise in public health in King County, CDC, et cetera. And we have used that throughout to guide our decision making, and we are in practically constant contact around those issues. Some of the principles that are key to us is, of course, we want to keep in mind first and foremost the educational experience of our students in the context, absolutely their health and safety. Those things are a balancing act that we always do. Our decision was based on how could we ensure their educational continuity and at the same time keep in mind their health and safety.
And so then, Dr. Kause, when you say that, you are saying that you're keeping the campus open, and yet you are making it so the students do not come into the classrooms. What is the difference?
Okay, first of all, I think it's important to realize this campus never closes. Our campus, our university has a huge healthcare function that absolutely needs to stay open, but also that we have students here that, for example, it may be a lot safer for them to be here than, depending on their particular circumstances, to perhaps get on a plane, to go home. We have some students here for whom travel to their home is not possible. And so we need to keep our students in mind, very broadly speaking. The other thing is that one of the things that, for example, we have large lecture rooms where our ability to deal with issues around social distancing are, we were already having students who, for reasons of, our students are not all 18 to 25-year-olds, who, for reasons that they were in some of the risk groups that have been identified by King County, students with disabilities, et cetera, were already not coming to class. And so we wanted to make sure that there was also fairness. When you start getting to the point where you have 25 to 30% of students in a class participating remotely, we have to think about what is the best thing for our students as a group.
And you talked about the precautions, obviously, of keeping in-person classes away because of social distancing. Are there any new precautions going in place in dining halls or other places that are still open where you're going to have a large concentration of students?
Yes, actually there's some additional measures we're taking, especially as it relates to dining. Some of the open bar areas, such as salad bars and soups, are actually going to be transitioned into much more grab-and-go opportunities for students to give them the opportunity to come in quickly, get what they need, and then go back to their rooms or wherever they choose.
So no open salad bars?
Correct.
Well, I mean, it shouldn't, now that I've looked at them, I was thinking, shouldn't we be doing that anyway? Before we'd have to have the coronavirus?
I can absolutely assure you that these moments are learning moments, and what we learn from these moments, we will think about more broadly.
And I will also say that prior to this, we've always implemented strict food safety handling. We have did that before the virus. We will do that now. We will do that after the virus. The salad bars and all those other open service were in compliance with those safety. We're just taking, you asked about additional measures, and that's some additional measures we're taking.
But I want people to, again, keep in mind, it's not like all the folks that are not attending classes are going to disappear. They are still going to be looking for ways to fill up their time. Some of them are very high energy folks, and we want to be able to continue to provide for them to be able to participate in the campus community. We are asking them to do it in ways that are safe in terms of personal hygiene, et cetera, et cetera. We are so.
Dr. Gottlieb, I know people quite a bit younger than I, and they have been frightened about this in ways that it seems maybe a bit exaggerated. I mean, you have a relatively young population here. How much danger do you think that they are in from this coronavirus?
Well, I think we have actually quite a mixed population here. We have faculty of all different ages. We have students of all different ages. We have members of the community that come on campus of all different ages. Some have disabilities, some have pre-existing conditions. Some might be immunosuppressed or pregnant, so in those high-risk groups. So as a community, actually, I think we worry about all those folks. Certainly there's data to suggest that younger folks without other medical problems may be less likely to have severe disease. We certainly want to protect our whole community, and so we're thinking about that, globally, not just.
To pick up on that point, you've had SARS, you've had MERS, you've had other things over the decades. Is this unprecedented in terms of the level you're proceeding at here for a long time, or is this falling in line with some previous movements you've done, realizing technology now makes remote classes possible that may not have been possible in these prior years?
Yeah, I think certainly we were worried about SARS and MERS and, influenza, of course, every year. But I think the scale of this epidemic is unprecedented compared to SARS and MERS. If you remember, the SARS epidemic in 2003, had about 10,000 cases, or 9 to 10,000 cases, and about 800 to 900 deaths. MERS has been sporadic, but much less. I mean, The data coming out so far is we have over 100,000 cases worldwide and 3,000 deaths. And as you know, our local situation, we've had, numerous cases and a significant number of deaths. So although were an issue, we're certainly concerned about the current situation.
Yeah, I want to add that we have responsibilities to our community, but to the community at large. And the issue that we're all dealing with is not only how do we stop this epidemic, but also how do we slow it down so that our healthcare system can respond. So that, it is about stopping so that no one gets sick, but it's also about some people are going to get sick, but slowing it allows our healthcare system to respond.
Dr. Kase, what about trips? We're hearing from people from the Foster School of Business. There's a trip planned to Asia for next week rather, and they are concerned that so far it's a go. What about trips of that nature? Is the university weighing in on those?
We are a very decentralized university, and we have different units that have very different kinds of responsibilities, So our public health department might be very different from Foster, our global health, et cetera. We have certainly made it clear to everyone that we want them to be very carefully considering whether or not travel is important, essential, and so forth, but we are largely leaving the detailed decisions up to our leadership, who knows most about the personal circumstances and the details. I can't respond to anything specifically. I don't know the details of that trip. I can tell you that there are a lot of trips that are being canceled, including one that I was going to take on Monday.
Where are you going, Dr. Kase?
I was going to San Francisco for a 2-hour meeting that I am going to do online.
Dr. Gonley, if we can go back to the infected staff member who worked in the Roosevelt Commons piece there, how can you reassure everyone that people who are still going to campus for certain facilities are going to be safe? And how many contacts did that individual, that staff member have, so that people can put this into perspective?
So that building is off campus, as you know, and that staff member was in a relatively isolated unit in that building, and we are in the process of, with public health and UW Medicine, assessing all those contacts and notifying them. We have temporarily asked the building to be closed for re-cleaning. We've sent notifications to all the people in that building about the situation, about monitoring their health. We do not believe, from what we know so far, that person has made any significant trips onto the campus itself or outside of that work environment.
Can you estimate how many contacts that individual may have had, and if that was?
Yeah, I can't give you that. I can't give you that data at that time, and we don't think there are any students that had any direct significant contact with that individual.
At what point did the staff member begin, showing symptoms and leading to being tested? What was sort of the timeline on the staff?
So I think for some privacy reasons, I don't want to get into too much details there. We learned about the positive test yesterday evening, and what we reported, we've looked at their activity, at that building and at work, and their last visit to their workplace was on the 28th.
And to anticipate a question, we made this decision before we knew about that.
And to clarify, please, earlier there was mention that there were 4 individuals that were being tested on campus. Is that right?
Yes, there were 4 students who were of interest. They were all tested. All 4 students came back with negative results.
So the only positive or presumptively positive result, and why do you presume it's positive?
Yeah, I can clarify that. So, as you know, there's been some significant issues with the test for COVID-19, or the virus that causes COVID-19, coming out of the CDC, and UW Medicine has developed their own test that's being run now through the UW Medicine system. But because of the FDA regulations on this, any test positive that comes out of, that's not a CDC or State Department test, has to be confirmed at the state.
So it is positive at this level then?
It's positive, yeah, it is positive using the UW Medicine test, which we think is a very reliable test. and we completely anticipate that it'll be positive at the state. But due to the rapidly changing situation, positive tests need to be confirmed at a second state lab.
Are there any more students or staff that are being tested or in the pipeline, if you will, that we don't know about?
Every day we're learning about folks who've had potential exposures and interactions, and currently I'm not aware of anybody who has a pending test, but we're getting that data, trying to get that data in real time. And as you know, it's a rapidly evolving situation, so we're trying to keep on track of that. And we're a 100,000 person community, so we're trying to make sure we learn about all possible cases and all the test results in real time.
Travel is a big issue for spreading this infection. So how have the athletic programs been affected?
Yes, the athletic programs, Pac-12 has their own group of experts that are consulting with not just the University of Washington, but, with Stanford, UCLA, Berkeley, with all our, who know specifically about situations with athletes. As you know, they often travel on chartered planes, so it's a little bit different, and they are giving them the best advice, and we are following that advice.
So has anything been canceled, any games or tournaments postponed or anything like that?
At this specific time, I am not aware of any, but it's an evolving situation.
And then Dr. Kelsey, there's other aspects of student life. I mean, Greek life. I mean, there's performances, performing arts. Are we discouraging students from participating in any of those activities, or are we telling students not to gather in places larger than 10 people? What's the advice that you guys are giving?
We are first of all providing up-to-date, latest information that we have both from our experts and the experts that we have across the country, and we are updating that and telling students, please consult this. Everyone in our community, please consult this information as you're making decisions. Again, I think that one can argue, having 50 people in a room that fits, 300, is that safer than having 10 people crammed into a closet? All of those kinds of things. We are providing people with the best information possible. We are encouraging them to make the decisions that are right for them. And in some cases, we may be giving more encouragement than that. But I am not. And we are asking them to please consult with your healthcare provider. They have phone numbers they can consult with if they're making decisions, but we are not providing blanket advice on every situation possible. That would be, I think, not providing good advice.
So, for example, like performing arts performance, like their leadership would make the decision on whether or not to cancel performances. Greek life would decide whether or not to cancel meetings. Is that what you're saying?
Absolutely, and like I say, we have a group that they can consult with as they are making those decisions. They know best about their venue, how close people would be together. There's a lot of, again, we are a very complicated, complex, multivariate organization, and blanket policies can sometimes, in fact, be more confusing.
So, sorry, just to interrupt real quick. One, I forgot to spell Jeff Gottlieb's name. Sorry about that. G-E-O-F-F. Last name was Gottlieb, G-O-T-T-L-I-E-B. Second, I just want to really clarify that the decision to move away from in-person classes was not connected to the presumptive positive case that we've had in the building off campus. The decision had been discussed and reached. As Dr. Gottlieb said, the positive test became known last night, and the decision to move away from in-person instruction had been made much earlier in the day, and was under serious consideration even the day prior. Secondly, I just wanted to give a chance for anybody on the phone to ask a question or two. So please, if you can, state your name, outlet, and ask a question.
If you can hear me?
Yes.
Okay, great. It's Anna Mona, horticulturist from the New York Times. So I'm kind of trying to puzzle through why, if it's not safe to be in class. I understand what the president said about some people can't go home, and so some people can't go home. But overall, why would it be bad to be in class but okay to be in the dorm, or
I want to be clear.
Or-
I am not saying
Yeah.
it is not safe to be in class. We took our actions with the abundance of caution and being very aware that in many of our classrooms, there is incredibly close proximity. Students are sitting in very close proximity to each other. We are very aware that when it comes to our instructors in particular, but also, we are a large public university. Our population is much more than 18 to 25. And so, like I say, we took a lot of factors into account. As I say, our campus never closes. We have students that are in our residence halls where we're taking extra precautions, and we are very much guided with the very best public health information possible.
So just to follow up on that, it might be that parents will decide to pull their kids out, and then...
Absolutely, because students
yeah.
don't have to be in person in class. They may choose. Many of our students live within an hour or two from here, and they may choose to return home, and that would be perfectly fine.
And that might have financial consequences for the university then, if they're not going to, if this goes on and on.
Well, first of all, we are going to make our decisions first and foremost in terms of what is right, in terms of the educational experience and the health and safety of our students. At this point, the directives that everyone has gotten from me is there will be financial consequences to our decisions. We will deal with how best do we mitigate them later. Right now, that is not going to be foremost in our mind as we're making decisions.
What financial
Thank you.
consequences do you anticipate, Dr. Kelsey?
When people, our entire city is dealing with, people aren't going to hotels, they're not getting their deposit, what happens when people don't travel. We have a range of things.
And less people on campus.
Right, there's less people on campus they're not using. Our health, our dining facilities are paid for by, every time someone buys, so that, there's going to be. I can't give you the full list, we haven't gone through it, but the clear directions that people have heard from me is, we will certainly do everything we can to mitigate financial effects. Our state has been fabulous, they've already put some money on the table, but right now, let's keep in mind, we will make our decisions based on the well-being of our community, and then we will deal with how do we deal with the financial fallout. I don't want anyone deciding that they're going to do this or that, because if not, they're going to lose money. That is not the way that we make decisions here.
You mentioned that you're taking extra precautions in the resident halls. What are those extra precautions?
So we've actually doubled the sanitizing cleaning that we do. We have enhanced the cleaning of high-touch surfaces such as doorknobs and elevator buttons and railings, etc. We've actually also postponed all of our kind of community programming events that brings lots of folks together. So we are giving students, as I mentioned in the dining, some opportunities to have much more grab and go.
Yeah, but again, I want to stress that, it's not like students are going to disappear. And so if we may have, and I don't like to speculate, but if you have even a student who lives 2 hours away, but they live in a crowded home where someone in the home is going out, backwards and forwards on travel or et cetera, they have to weigh, is that a better place, or is maybe being in the dorm with one roommate in a more confined area a safer place? That it's not like we are sending, that by closing things, we are sending people out into situations that are necessarily safer.
And this decision goes through the end of the quarter, but when we get to that end of the quarter and you start to consider bringing back the spring, what are some of the considerations that are going into place? And is there a threshold to say, okay, we have met this, or we are at this space, and now it is finally okay?
Yeah, we have every intention of reopening next quarter. Students will be coming back to a very safe, very clean campus. But I don't have a crystal ball. I can't say where we're going to be at with COVID-19 3 weeks from now. And, that could change based on an evolving situation and new information. But at this point, we have every intention, and we are working towards reopening our campus. I will be very honest. We are also going through scenarios of how would we do distance education for a week or two.
Got
What
time
is
for
the
two more
date for that?
questions.
What is the date for the reopening as you plan it out now?
I believe it's March 31st.
30th.
March 30th would be when we would plan to reopen.
Okay, two more.
Just some personal reflection, really, from anyone on the table right now. I mean, a lot of people are dealing with this in many different ways. I mean, some people are freaking out, others are remaining calm. Dr. Kelsey, I mean, how are you handling this? Dr. Gottlieb, I mean, and Denzel, is this unprecedented? How are you guys dealing with this?
Well, I think that one thing that we all need to keep in mind is this is happening against a backdrop where there was a lot of anxiety anyways. We have been in a difficult time in this country in numerous ways, from concerns about the environment to our political, some of the bickering that we've been seeing, et cetera. And so to add another layer of anxiety has been very difficult for any of us to handle in one way or another. But, and this is something that we've been communicating, we make the best decisions when we are as calm as possible. And so again, we want to, as much as possible, get people into a calm space where they can make good decisions. We believe in making science-based decisions. We are providing our community with the latest information so that we can advise them, but then they can make decisions based on their personal circumstances, including health, including family situations, et cetera. So we're trying to empower people to make good decisions. But I want to say, our campus is amazing. There's always all these coincidences. So for example, I was talking to our ASUW student senators just on Tuesday. The plan was not going to be, and Jeff came with me, the plan had initially not been at all to talk about this. It's a yearly meeting that I have with students, and we started talking about this. They've been reading the material. They were incredibly calm. They had really good questions. Our faculty, they are really stepping up in terms of what they can do online, how to be ready, how can we best support our students, our advisors, our librarians. We can put things online so that students can continue to get the best advice possible. I have to say that we have an absolutely amazing community that really is using this as an opportunity to step up for our community, but also for our region, for our nation, for the world.
Last question?
Dr. Gottlieb, you are, obviously this is a big advantage for the University of Washington having this big medical center and folks like you on the staff here. Talk a little bit more on any consultations you've had with county health, state health, federal CDC, anything like that in coming to these decisions.
Yeah, sure. So every day we are meeting as a group. The Advisory Committee on Communicable Diseases is meeting every day or multiple times a day. We're in consultation daily, if not multiple times a day, with our colleagues at King County Public Health, and for our Tacoma campus public health down there. We're meeting with the state representatives, and we're getting guidance daily from the CDC. We also have, as you know, a huge medical center, experts in infectious disease and epidemiology, and we are consulting with UW Medicine and all our experts there, which, as you know, includes not only UW Medical Center, but Harborview, Northwest, and Valley. So it's a very coordinated effort. And so when we're thinking about interventions on campus, we're also thinking about getting our expertise from our medical center colleagues too.
Yeah, if I could add two things about it, and Dr. Gottlieb, you may want to add more, but as part of what I've been talking about in terms of leadership, our population health initiative, et cetera, is that folks should be aware of that we've been having a flu study that has been ongoing. So we probably have the best information in the country about how this will move forward. It also means that we have probably the best diagnostics. And so the fact that we may have more positives is partly because we have more testing and better techniques, not necessarily because we are the quote-unquote epicenter. And so we will have some of the best data. We also have right now another reason to keep our campuses open. People who are working in their labs working on a vaccine for the coronavirus.
So based on that, what do you see, either one of you, is the sort of the trajectory here? Or is it because you're going to plan to open for the spring quarter. You're working on your contingencies. You're all very smart people. What do you kind of, how do you sort of base that trajectory based on what we're seeing with the spread and everything else as it applies back here?
You know, we don't obviously have a crystal ball. I think we do expect more cases to be seen in our community and on the campus as time goes on. But I think we'll do everything we can to keep our critical missions going, including our healthcare centers, our research centers, and continue to do everything we can to keep our student, staff, and faculty safe.
Quickly, I have a question. The person that was a staff member at Roosevelt Building, were they all connected to life care?
Not that we're aware of. We're still digging into that, but not that we're aware of.
Okay, thanks everybody. We're going to have maybe just a couple of minutes if you want to break out and talk with anyone from the panel. I just want to reiterate just one thing. The decision to move away from in-person classroom instruction was really, as President Kause said, out of an abundance of caution and trying to eliminate the gathering of groups in tight spaces, but also it's been done very, very methodically and strategically in order to improve, to ensure a seamless end to the quarter and to recognize the hard work that students have put in to this quarter in as fair a way as possible. So thank you all for being here, and like I said, all three of our esteemed panelists will be available just for a few minutes around the room. Thank you.
And thank you all.
Thank you.
Thank you.